Congratulations on your pregnancy, and thank you for partnering with Sentara CarePlex Hospital to deliver your baby. Our Family Maternity Center created a slogan when we opened, a slogan that summarizes the feeling we want each visitor to have when they're with us. Our slogan is, "The snuggle is real." To us, that means during our time together, we are loving, caring, compassionate, and warm, giving you a feeling of comfort. I hope you'll experience that feeling too during this virtual tour, which is designed to show you where you give birth and how we can best prepare for your time with us. You might already be familiar with parts of Sentara CarePlex Hospital, especially if you participated in our Stork's Nest program, which is designed for pregnant women who would like to take care of themselves and their babies and earn incentive gifts along the way. Working with the March of Dimes Foundation and Zeta Phi Beta Sorority, our team at Sentara CarePlex Hospital wants to do all we can to support happy, healthy moms and babies. My name is Jackie Jones, and I'm the clinical manager for the Family Maternity Center here at Sentara CarePlex Hospital. The staff and I look forward to working with you during your pregnancy, labor, and delivery. We hope you enjoy getting to meet a few of us during this video.
Hi, my name is Angela Randolph. I'm the unit coordinator at the Family Maternity Center. When you believe you're in labor or you're scheduled for an induction or a C-section, you can find us at 3000 Coliseum Drive in Hampton. You can park in the front of the hospital. We have designated special delivery parking spaces, and we will provide you with a parking pass to display in your vehicle once you are admitted. Be sure you've packed a bag with shoes or slippers that are easy to slip on, personal care items, snacks, going home outfits for you and your baby, your picture ID, and your insurance card. You can enter the hospital through the main entrance. Look for the elevators near the cafeteria. Head to the second floor and you'll see the Family Maternity Center, a unit we keep locked at all times. That's where we'll get you registered. We take special precautions to protect you and your loved ones during a community health concern, such as the COVID-19 pandemic. One of those precautions is limiting the visitors to one person. This will be your support person, the one you have chosen to help you throughout labor, delivery, and recovery. We will test you for COVID and check your support person's temperature. Masks are required for everyone. While we aren't wearing any during this video, you will see us doing so along with eyewear at all times during a community health concern. We are also practicing social distancing, extra hand washing, and enhanced cleaning. Usually soon after delivery, you can have professional baby pictures taken. Because of the COVID pandemic, we are temporarily pausing this service. We will offer it again as soon as possible.
Hi, I'm Crystalyn Davis, a nurse at the Family Maternity Center. When you arrive, we'll ask about your pain tolerance and birth preferences. We want to honor your requests, as long as it's safe for you and your baby. After we assess your labor progress in our triage area, you'll head to our birthing suite. If you're scheduled for a C-section, we'll still take you to your room first to get settled. Once you're in your birthing suite, we'll get you connected to our monitoring systems and offer tools and comfort items such as peanut balls, squatting bars, and a shower. Our state-of-the-art beds with adjustable drop-out bottoms are designed to help you labor in a position most comfortable for you. If you like, one of our mobile electronic fetal monitors are available. You can walk through our halls during early labor. Your partner or support person will also be comfortable with a large pull-out sofa with built-in charging station, a Keurig coffee machine, K-cups, an Amazon Echo, and a mini fridge. Immediately after your delivery, our nurses will evaluate your baby and make sure he or she is given vitamin K and erythromycin eye drops. These help with blood clotting and fighting infections. A little bit later, we encourage a hepatitis B vaccine and screen your child for more than 50 diseases and disorders, as well as check for loss of hearing and congenital heart disease, and offer circumcision if appropriate. We have dedicated pediatricians from Children's Specialty Group in-house 24/7, who will provide ongoing care to your baby while you're here. My teammates and I always keep a watchful eye on your baby. If we identify any concerns that require attention outside of our immediate care nursery, we collaborate immediately with one of our several nearby Level 3 neonatal intensive care units, which are specially equipped and staffed to care for premature and critically ill newborns.
I'm Whitney Brown, a nurse at the Family Maternity Center. and I'm happy to share more with you about what you can expect immediately after you give birth, a precious time for mother and her child. For an hour or two after delivery, you'll stay in your suite, bond with your baby by holding him or her skin to skin and breastfeeding if you choose. We call this time the magic hour. If you're too tired for skin-to-skin time after a C-section delivery, your partner or your support person is welcome to take on this honor. With the birth of your child, we continue to prioritize safety. We place a small tamper-resistant security tag on your baby's ankle. If there's any attempt to remove the tag or your baby is taken near an exit, an alarm will sound and the doors will lock. We place the other 2 special bands on your baby and the other one on your support person. We compare the numbers on the bands whenever we bring your baby to and from you. Once you had time to bond with your newborn immediately after delivery, you'll most likely stay in the same birthing suite. Occasionally, we have many babies being born that we may assist you to one of our postpartum rooms, which offer many of the same features as the room you'll deliver in. In either case, we follow the mother-baby model, where the same nurses care for your baby and you. Unless you're completely exhausted and request our nursery staff to watch your baby for a few hours, your baby will stay in your room. This way, you can bond, learn feeding cues, and breastfeed if you choose. Our nurses are well-trained in lactation, with staff members who are international board-certified lactation consultants. And we're thinking about food too. We'll have meals delivered to your room by one of our catering associates, and we offer a special celebratory meal for both you and your partner or support person. We also have more food options in our cafeteria, and your support person is welcome to also bring in any food you like.
You'll stay with us anywhere from 1 to 4 days, depending on your delivery, and if needed, we can provide you with flu and Tdap vaccinations. Once we determine that you're medically stable, you're set for discharge. Remember that even if you're an experienced mom, care for both you and your baby can change with time, and an education refresher would be a perfect opportunity to update your understanding of your care for you and your baby. Our birth registrar will work with you to complete a birth certificate and a paternity affidavit if you need this. Your baby's father will have to show legal identification if you need the affidavit completed. You will also need to bring a check or money order payable to the state health department for $12 for each birth certificate you order. The very last thing we do is remove the baby's ID band and security tag just before we walk you to our front door. Again, congratulations on your pregnancy. We look forward to working with you during your upcoming birth, and thank you for partnering with Sentara CarePlex Hospital. It will be an honor to assist you and your baby.